actually is, by definition, is a brain disorder, which is acute one, which is due to blood vessel problems. Usually we classify into two particular broad types. One is due to the bleeding inside the brain, usually due to rupture of the blood vessels. Second one, the more common one, actually is due to blockage of the blood vessels. So these are two broad types of the stroke. There's a wide range of symptoms related to stroke, as simple as, for example, people feeling numbness on the one side of the face or half side of the body, or to more severe one, they will feel the slurring of speech, and sometimes they will feel the problem in the limb weakness on one side of the body. In the most severe case, people just pass out or even in a comatose state. All these are symptoms of stroke. Patients feel is quite variable. Some will just feeling some numbness just lasting for seconds or minutes and it goes away, and the patient think may not be a stroke. But most obvious cases, they will find the problem in talking, and there's a drilling of saliva, and they cannot move one side of the body. This is more severe one, and of course most people will look for medical attention in these more severe cases. But sometimes they just go unnoticed in some patients, and not surprisingly, sometimes we use some imaging tools that we find patients may have multiple episodes of stroke, but they don't feel that. And in the CT scan, for example, we can see those problems inside the brain. I think it's very important to make sure that the patient is really in trouble, like if it's comatose or does he respond to you. And if you suspect the patient having a stroke, for example, if they present with a slurring of speech and half side body cannot be moved, then you should call the ambulance urgently. The reason because in the first few hours after stroke, doctors may be able to save the patient's life by means of some emergency medication or emergency interventions. So call the ambulance. This is the most important thing to do. Stroke happens more commonly in elderly people, especially with those traditional cardiovascular risk factors. For example, if they are suffering from diabetes, they have high blood pressure, they have high cholesterol values, or they have coexisting heart rhythm disorder, in particular atrial fibrillation, they are very high risk of having a stroke, and they should have medical attention to prevent the stroke episodes. Atrial fibrillation is the commonest human sustained arrhythmias, and it's happened more frequently in the young elderly people. And normally for a patient who have normal rhythm, usually the heartbeat is one by one in a regular manners. However, in atrial fibrillation, the heartbeat becomes irregular. The most difficult part is that the atrium of the heart chamber will be lost its function as a pump, and there will be slow blood flow inside the heart chamber, and blood clot will form. And this blood clot following the circulation going to the brain and causing blockage in the blood vessel, there is a stroke. In fact, atrial fibrillation is the commonest cause of stroke, especially major stroke in elderly people, and that's why it's highly related to the stroke. The assessment of risk factor for stroke, I think, is quite similar to a patient with heart disorder. Mainly, it's about the three important risk factors, including the blood pressure, the sugar levels, and also the cholesterol level. And these are the things that we have to well control for people who have high risk of stroke to prevent them to have one. And lately, we know that atrial fibrillation is one of the cause for the stroke. That's why we always do a EKG, check the rhythm of the patients, and sometimes if necessary, we'll use ultrasound to check the heart function, because all these are important risk factors for stroke. There are many ways to prevent a patient getting a stroke. Number one, of course, is a healthy lifestyle, including regular exercise, at least 30 minutes a day, and also have a more healthy diet, including more green like salads, or using a better oil like the olive oil for cooking. And then try to avoid too much meats, and these can help to control the cholesterol levels. But more specific measure is by controlling the risk factor, including the sugar levels, cholesterol level, and the blood pressure. And by doing so, the majority of people will be having no such a problem or having a stroke. But in some special group of patients, for example, if they have atrial fibrillations, and these are the very high risk of stroke, then some patients may require a blood thinner to prevent stroke. So, and for also patients with a coexisting heart problem, it's very important to use certain kind of simple blood thinner like aspirin. These are all very effective to prevent stroke in high-risk patients too. Based on all the latest medical literature, COVID did increase the risk of stroke, even in younger patients. There are several studies showing that the patient, even in the convalescent case or very asymptomatic patients, but they are infected with COVID, they have a higher risk than the general population to have a stroke. So we have to pay attention to this patient, especially if they have coexisting cardiovascular risk factor, and medical attention is really necessary for these high-risk cases. I think heart problem is very common and very serious disorder. In 1 minute, you can talk to the patient, the next minute he may pass away and pass away because of heart disorder. So I think that my interest is, even at very young kids, I like to treat the heart problems, and then that's why I spend most of my careers in cardiology.